Welcome to City and State. I'm Editorial Director Michael Johnson. I'm joined today by Seth Diamond. He's the Chief Operating Officer of MetroPlus. Thanks for joining us.
Thank you very much for having me,
And tell us a
Michael.
little bit about what MetroPlus is and in your relationship with the New York City Health and Hospitals.
Well, MetroPlus is a health insurance company, very similar to the health insurance companies people have heard about. We're a little different because we're owned by the city's Health and Hospitals Corporation, but we offer the products and in the places that people are traditionally looking for health insurance. We offer products to city employees as part of the city employee market. We're on the Affordable Care Act exchange, so we're one of the companies that people can go into now as part of open enrollment and sign up. We have Medicaid as one of our products, Medicare, and some specialty areas. So we have a wide range of products. We offer something for everybody. We focus on being very low cost and effective for people, particularly low-income people. But we have high-quality insurance at a good, affordable price. And we have about 500,000 people who've signed up for MetroPlus in one of our areas.
So, I mean, I think what the natural conclusion people are going to see when they hear that MetroPlus is tied to the New York City Health and Hospitals is that you only have service maybe from those hospitals if you are a MetroPlus member. Is that correct? Or?
Well, I think that used to be the traditional view, that we were so closely tied with health and hospitals that our only business was from them, that everybody who signed up for MetroPlus got all their services from the Health and Hospitals Corporation. But just as Dr. Raju has worked to broaden the vision of the Health and Hospitals Corporation so it serves all of New York and it's seen as a plan of choice for people throughout the city, MetroPlus is in the same position. We're following that vision so that all New Yorkers can pick the health, could pick MetroPlus, and we have something to offer. We're the lowest price plan in the market, and we have over providers at over 27,000 sites, so a wide range. Some of them within the Health and Hospitals Corporation system, but a lot of them in communities throughout the city. So we want all New Yorkers who feel we can meet their health care needs, particularly those who are looking for low price but value health care. They should sign up with MetroPlus.
And yeah, I wanted to talk about price because you guys are now lowering your prices, and it's a situation, we talked about before the interview started, and in my conversations with Dr. Raju, we've always talked about how health and hospitals is kind of like that safety net for that more vulnerable population. I don't know if you guys view yourselves the same way, or if it's just a situation where you know that there is a need out there. There's, I think the last estimates were 400,000 New Yorkers who are without health insurance. This is just a way to get them kind of into the system.
Well, we have a broad range of plans available. We certainly want to have plans for people who are low income or traditionally been uninsured. One of the great barriers for people who have not gotten insurance is price. They've been afraid that health insurance is too costly. They don't know that they can afford it, they don't understand, or they don't know about the subsidies that are available to help people. MetroPlus is there for those people. We have the lowest cost plans in the market, and we have a new plan this year that's just coming into effect called the Essential Plan, which offers insurance for people who don't qualify for Medicaid, make a little more than the Medicaid limit, but still are low income. And that premium for that is $0 or $20 a month. So it's very low cost. But we also have other plans for other people who can afford to pay a little bit more. So we have a wide range of services. Dr. Raju has challenged us to make plans available to all New Yorkers who are interested in our services, and we've broadened our reach in response to that challenge.
I know one of those plans is MetroPlus Gold. Tell us a little bit about what that plan is. I think that's something that our viewers are very interested in.
Sure, it's very exciting. MetroPlus Gold is an insurance product for city employees and also other public employees at the city university system, at the public library system. And it's traditionally only been available for employees within the city's Health and Hospitals Corporation. So we have over 3,000 people within the city's Health and Hospitals Corporation who've chosen MetroPlus Gold as their employee-provided health insurance. Starting this year, we've broadened to include all city employees who can pick us and public employees at CUNY and at the library system. So it's a much broader option. It's an option for a much broader group of people, and we're still very low cost, no premium, no deductibles. So we're very affordable, and we have a great selection of providers. We think that it's a good choice, especially for people who are looking for real value to make a good choice at MetroPlus Gold.
So you're talking a lot about, I mean, the different options that are available. It gets to this point that Dr. Raju also mentioned to me, is the idea that, you know, in the post-Affordable Care Act or Obamacare world, it's becoming more competitive, which is actually better for a lot of consumers. Are you seeing that the same way on the insurance level as far as what you guys are doing? Are you thinking differently now since the since Obamacare has been passed?
Sure, it's a whole different healthcare market. When I was growing up in New York City, if you were low income, you had one choice where to get your care. You went to the health and hospital system down the street. If you got treated well, if you got treated poorly, you went back there the next time because you had no other option. Now low-income people have lots of choices. All the hospitals in the city want their business. Insurance companies throughout the city want their business. I've worked to advocate for low-income people my entire career, whether it's in housing or employment and now healthcare. And the idea that they can have all these choices is wonderful. But what it does to us working with the Health and Hospitals Corporation is make it a much more competitive market. We have to fight every day for every customer. And that's why we're out showing why people should join MetroPlus. We can't have any guarantees that they're going to come to us. We don't have a captive market. We have to fight for every customer. We have to show them that we have the lowest prices in the market. We have to show them that we have good customer service. We have to show them that we have doctors in the specialties that need them where they need them. And by doing that, we're able to convince people to come to MetroPlus. That's why we have 500,000 people who've entrusted their health care with us.
Seth Diamond, the Chief Operating Officer for MetroPlus, thanks so much for joining us.
Thank you very much.